Hello people, in this video let us look at the content, the syllabus of dermatology for MBBS students. So basically dermatology comes under general medicine. So under general medicine you have medicine, psychiatry, dermatology and TB and respiratory diseases. Okay. So basically dermatology, now we are looking at the course content. We have already seen the textbooks, haven't we? So under dermatology, they want you to learn about the skin diseases, sexually transmitted diseases and leprology, okay? And you should refer any rare diseases to specialists, etc. Here are the objectives. Skills, as such skills what you should be having, you should be able to talk to the patient, get the correct history, right, information, correct history, etc. in chronological order. You should also conduct clinical examination, elicit and interpret physical findings. You should be able to diagnose common conditions, you should be able to diagnose at least the common ones. And emergency situations, you should be able to identify, handle, refer, etc. etc. You should be able to do some simple procedures, etc. for making some bedside diagnosis, especially for STDs, that is sexually transmitted diseases. You should be able to examination of scrapings for fungus, preparation of slit smears and AFB, that is acid-fast staining, right, acid-fast bacilli staining for leprosy patients. You should be able to take skin biopsy for diagnostic purpose, okay. Interesting, that looks quite invasive, right. You should be able to take a skin biopsy for diagnostic purposes. You should be able to manage common diseases, refer, etc. So now let us look at the exact content of dermatology. So you should be understanding the diseases which are caused because of nutrition and environment factors. You should know about infective disorders like pyoderma, common viral and common fungal infections, right? Then melanocyte, you should know pigmentation, all that. Disorders of pigmentation, vitiligo, diagnosis, ichthyosis. What is this? This is vitiligo. This one is showing ichthyosis. Ichthyosis is presence of excessive amounts of dry surface scales, keratinization, cornification, abnormal epidermal differentiation or metabolism. Disorders of pigmentation like albinism, chloasma. So this is albinism and chloasma is this one, okay. So then allergic disorders like urticaria, atopic dermatitis, contact dermatitis, all these become allergic disorders. Urticaria is also called as hives. All these are allergic conditions. Let us look at what atopic dermatitis is. So here you can see atopic dermatitis. Moving on, contact dermatitis. Contact dermatitis here. Basically contact dermatitis is because of these jewelry and all that, right? In fact, anything that has touched you, soap, cosmetics, fragrances, even poison ivy. So currently we are here guys, dermatitis and eczema. Dermatitis is a very generic term for skin inflammation. Look at eczema here. So basically here skin is inflamed, that's what we told you, right? Skin inflammation generally is called dermatitis. Skin is inflamed, itchy, red, cracked, rough. How's it going guys? Are you able to get some idea of dermatology? And also we are giving you the basic things here. So images also so that you will learn some terminology. Let's continue. Vesiculobullous diseases like pemphigus, vesiculobullous diseases like pemphigoid, dermatitis, herpetiformis, okay. So pemphigoid is autoimmune condition, blistering rashes on skin, okay. There's some terminologies you should know here like macule, patch, plaque. If it is solid, if it is flat, it is these words, okay, macule, patch, plaque. If it is elevated, then it will be a papule or a nodule or a vesicle or a bulla. Pustule, if it has pus, it is pustule. If it is fluid filled, it's vesicle, right? And look at this one. What else you should know? Lot of terminologies are there actually. At least remember, if it is flat, macule or patch or plaque. Plaque is indurated. So basically look at the dimensions, small, large, macule, patch. So this is what? It's a patch, right? It's big, isn't it? and this is hyperpigmented. So papule, and the bigger one of that will be what? It should be nodule. Papule, nodule. Macule, patch. Papule, nodule. Like this you have to learn, okay? Indurated, they are using this word plaque. Plaque, plaque. Vesicle is fluid filled. If it is big size, bulla. Vesicle, bulla. See guys, you have to remember this. Vesicle becomes bulla, papule, nodule, macule, patch. Macule, patch, papule, nodule. And what else? Vesicle, bulla. So in the syllabus, we were here, vesiculobullous diseases. Vesicle is small, bullous is big. Vesiculobullous diseases, pemphigus. What is pemphigoid? So all these are autoimmune diseases. So we saw what? This is pemphigus vulgaris. This is pemphigoid. So you can look at some clinical presentations here. Dermatitis herpetiformis. What is this? Herpetiformis, DH. Bumpy, itchy skin rash, common in people with celiac disease. Autoimmune again. Then why is this herpeti? So it's nothing to do with herpes. It's an autoimmune disorder. Yes, actually the word should be celiac. Celiac, abdomen. Okay. Celiac disease. Then we will look at alopecia. Then hirsutism. Hirsutism is what? Hair. Excessive hair on parts of body where hair is normally absent or minimal. Male pattern, like if they are taking something which increases the male hormones, right? That can happen. So alopecia, hirsutism. Then what else you will see? Function and structure of sebaceous gland and diseases. Very famous. These you will know. Acne, seborrheic dermatitis, other diseases of sebaceous glands. Acne should be show photo. There you go. Seborrheic dermatitis. Look at these. So many terms are there to know. Pityriasis capitis. Dandruff. Pityriasis capitis. Dandruff. That's all. Then diseases of sweat glands, the structure and function and disease of sweat gland. What was it earlier we saw? That was sebaceous gland, the oil secreting one, right? Now sweat glands which secrete sweat, right? Miliaria, not like malaria, it's miliaria, hyperhidrosis. Let's look at these. This looks scary actually. Look at these photos. It's on infants. So like we told you, it's related to sweat gland. So small itchy rashes due to sweat trapped under the skin, clogged sweat gland ducts. Okay. Hyperhidrosis, abnormally excessive sweating, that's not necessarily related to heat or exercise. Wow, you're soaking so much that you're dripping. But it's not hot or you have not exercised, okay? So look at these sweaty hands. Hyperhidrosis. So guys, not to worry, we have reached the end. These are the last 4 topics that we want to cover. 4 or how many? 5 are there. Leprosy you know, right? Caused by what? Mycobacterium leprae, bacteria. So the person will have some kind of anesthetic patch, etc. Right? Psoriasis, look at this psoriasis. Oops. So psoriasis, very important. Sexually transmitted diseases, what and all will you give? AIDS, but the AIDS will not have any skin. They can have skin manifestations. Okay, then syphilis, gonorrhea, then herpes, yeah. Then dermatological therapy. So you will learn a lot about therapies there, and lichen planus also you will learn. This one is lichen planus. So lichen planus is called so because of the way it appears in pathology, right? So why is this lichen planus? It's inflammatory condition, yeah, of mucous membrane, skin and mucous membrane. Again, it's an immune system attack, okay. Guys, so let us look at what skills are expected out of you in dermatology. Skills. You should be able to perform skin scrapings, KOH preparation for fungal infections, slit skin and nasal smear for lepra bacilli. So these are what they are expecting skills you should be able to do. See, manual things you should be able to do are skin scrapings, KOH mount, slit skins, nasal smear for lepra bacilli, all these, okay. So these are some images from our dermatology posting. Stevens-Johnson syndrome. See, this is a leprosy patient. You can see here the trophic skin ulcer they're saying, because they cannot feel the pain, right? They cannot feel, so they have ulcer there. Fungal skin, you can see this kind of rings, right? These are ringworm they call, right? But these are fungus actually. Tinea also, they call it as tinea, right? Remember, tinea is tiny. That means it's caused by fungus. But tinea, tinea becomes those worms, right? So you know those worms? Tapeworm, isn't it? Tinea solium, tinea saginata, all those. Ta becomes tinea, big one. Ti becomes tinea fungus. So you have to be looking at these fungal infections, tinea, okay, tinea. And this is herpes zoster, shingles. So basically the zoster virus after causing chickenpox sits in the ganglions, right? And once the person is immunocompromised or old, they can come out and cause this kind of vesicles. So these are affecting a single dermatome. So you can understand, you have to know about the dermatomes. So usually this zoster shingles will be unilateral, okay? It will affect unilaterally. So we have already covered all this in the microbiology lectures, isn't it? Varicella zoster virus, which causes chickenpox, and later if it comes, it is called as shingles, herpes zoster. So basically shingles will be unilateral vesicular rashes. So they are confined to skin which is innervated by a single sensory ganglion. So it is the dermatome you should understand. So in this video we have taken an introduction into the dermatology, the syllabus, etc. Exactly, we have looked at the course content, the skills that is expected out of the person. We have just looked at some common conditions, the names, the photos, right? And basically we have also tried to understand what skills are expected out of an MBBS graduate. That's all for now in this video. Bye bye.